Hi, I'm Chinzia Coppola, and I did a research, evidence-based practice literature review. My topic was a life after gastric bypass, remission of diabetes type 2 mellitus. So let's get started. So what is the problem statement? So I reviewed a bunch of literature looking at the success rate of remission of diabetes mellitus type 2 after bariatric surgery. So there are an estimated 422 million people currently diagnosed with diabetes, type 2 specifically worldwide. This number, according to the World Health Organization, is expected to double by 2030, which is a pretty scary thought. Majority of these people that suffer from DM2 have other comorbidities and are obese as well. So starting in the 1950s, jaw wiring was considered a bariatric surgery, or it was a weight loss surgery, but it has evolved since, which is great. And bariatric surgery has declared a spot as a long-term effective treatment for DM2. Longstanding research provides consistent evidence that Roux-en-Y gastric bypass specifically has an 80% remission rate with DM2 post-surgically and a 60% remission rate for vertical sleeve gastrectomy. Although there's no confirmation of how the surgery actually works physiologically, the best hypothesis is a multifactorial. An enteroendocrine alliance that is affected, which in turn affects hormones like glucagon-like peptide that enhances the secretion of insulin, and peptide YY that aids in gastric motility. It has not been solidified as to how these hormones are actually changed, but it is thought that collaboratively these two hormones are more effective after a gastric bypass, even without weight loss. This in turn helps the patient achieve normal glycemia, thus putting the diabetes in remission or improving the diabetes greatly, having the patients come off of all or majority of medications that they take. So the significance to nursing as far as research, the remission of diabetes mellitus type 2 from bariatric surgery requires more research on the education side for long-term success and support from a nursing perspective. There's a multi-layer approach that should be taken with folks that have bariatric surgery, especially for long-term success. It's merely a tool for weight loss with an added benefit of putting the diabetes into remission. However, there's a lot of mental health side effects that go along with it. Some people experience addiction transference by where they trade in their addiction for food for either alcohol or something else. And really just having a team to support you, such as nursing staff, can go a long way. In education, the significance to nursing, much of diabetes management and gastric bypass are revolved around education, educating patients on how to use their new tool, what is expected, and side effects, and what is expected is there's just common times that you peak for your weight loss, that research shows there's a lot of old habits that come back after 2 years post-op. 5 years post-op is another hard time that that patients see. So again, educating the patients to go back to their surgeon or nurses or whoever else, nutrition support groups, any other person that can aid them and support them and help them see how far they've come is really great to the patient and for the patient. And last, in nursing practice, teaching again in preparation for surgery and the importance of follow-ups and management after. Caring for the new tool of gastric bypass requires a lot of support personally and professionally. Gastric bypass is called a tool because it's not a magic fix. As I said before, old habits can come back easily. So if you're not following the rules of bypass, which every surgeon is slightly different, these old habits will come back and unfortunately either bring the diabetes back or have the patient gain their weight back. So the purpose of this literature review was to assess over 30 years of research, starting from jaw wiring to modern bariatric surgery, and gain a better understanding of how a non-communicable disease that has doubled cross-culturally in whom it affects can be abated with a surgical intervention. So diabetes is extremely interesting to me personally. Not only was I affected by it, I was diagnosed at a young onset, and I had gastric bypass, and it is in remission, and it has been since the day I woke up from surgery. So I have a personal attachment to this literature review, but I find it fascinating that cross-culturally, in the different diets, the different lifestyles, it really affects so many people. And as I said before, different diets, different lifestyles, which are huge for diabetic patients in the management of it, is just completely fascinating to me. And then second to that, a surgical intervention by bypassing a portion of your stomach and reattaching the jejunum up to the stomach and bypassing all the intestine and rest of the stomach, and has an effect on hormones and kind of waking everything up is just really, truly amazing. So the research is pretty consistent. The evidence shows that bariatric surgery is a successful remedy for diabetes mellitus type 2. The results are seen best with specifically the Roux-en-Y, which is the full gastric bypass where the jejunum attaches to the stomach, bypassing stomach and intestine. There are predictability factors that can contribute to whether a patient would be a good candidate for the surgery to aid in weight loss and the remission of type 2 diabetes. Another consistency is that the treatment shouldn't be overgeneralized and just recommended for all patients that have diabetes. The success rate in remission of DM2 also correlates to the amount of time the patient has been diagnosed with DM2. And overall, the surgery has been a success and has paved a path to further research on how the surgery works to possibly imitate the effects in a capsule form. So my research questions, or can gastric bypass be used as a generalized go-to treatment for all patients with DM2? And what is the mechanism of action that happens after gastric bypass that puts the DM2 in remission or lessens its severity? So as I said, the evidence is all concurrent in favor of gastric bypass to remit DM2. However, this treatment cannot be generalized for all patients with DM2. There are many considerations and need to be cautiously handled on a patient-by-patient basis. Thank you.